The older adults who had dementia, diabetes, or stroke in combination with other chronic conditions told us that too much emphasis is being placed on their single health condition or disease rather than who they are as whole people. Another theme that we're finding is that older adults who have these multiple chronic conditions are seldom receiving care that is focused on disease prevention and health promotion. So it's really focused on dealing with crises of their illnesses rather than thinking more broadly about how to prevent further crises, how to promote their health. Another thing that we found is that there was very little focus on what we call the social determinants of health. So very little focus on issues such as transportation or income issues that also affected their health. Finally, the family caregivers of these individuals told us that they were very burdened, very stressed. They had to do a lot of navigation types of services and other services, and it was very stressful for them to provide care for these older adults.
We need to find better ways to help people self-manage.
Dr. Kimberly Fraser's team is examining the challenges of those older adults, including managing numerous medications and therapies, resources for emotional support, and why current care tends to focus on single conditions.
We still are very disease-specific in our health system. Depending on what is most bothersome for a client, we might treat that first at the expense of others.
Well, a very unique outcome that we're very excited about is that some of the family caregivers have actually volunteered to stay and become a part of the stakeholder committee and also to stay on the research as part of the research team.
I was very pleased to be asked to be interviewed during the process when my husband was ill, because it gave me an opportunity to explain my point of view and what I was seeing in the system. What I want to do is continue my involvement with the stakeholders group so that change can come about and that I can be part of that change.
We invite you to follow the progress of our research by viewing all the studies on this website.